some decision trees to help these agencies assist seniors. So that's ongoing. And, we're in the process of, even as we were out vaccinating over 1,000 people just yesterday at the fairgrounds, we were working in concert at the same time with our emergency management agency and these partners to begin helping us craft messaging to assist our senior population. So I don't think it's going to be weeks. I think we're working on that over the next over this next week here.
Thank you. And if you don't mind, given this kind of weird bridge in Cuyahoga County between 1A and 1B, so there's about 10,000 folks left in the 1A group in our county. I'm wondering, should those folks start clamoring for spots at the pharmacy and stuff to move that process along? Or are those folks limited to going through the Board of Health for their vaccinations?
Right. So if we look at every urban county across Ohio, whether it's Franklin or Hamilton or Montgomery or what have you, they will have a large 1A population, and everybody else also is going through this, this sort of a foggy transition from 1A to 1B across the state, because there's nothing, all this process being made up out of whole cloth. We've never done this before. So I think from my standpoint, inevitably we knew this was going to come, particularly in a large county with a lot of healthcare providers. So I think the 1A folks, we have them on our list. We've been contacting them, and we've also assured them that we're not going to forget about them. And I think that that's important for us to stay in that lane. Our hospitals also have been vaccinating and continue to vaccinate their workers, and are doing that over the next week as well to focus on that. But in this near term, these pharmacies will be focusing on 1B population, even as the health departments and the pharmacy partners that are doing long-term care in nursing homes and our hospitals finish their 1A populations. So there'll be some concurrent activity going on, but 90 providers doing 1B work is a lot of people out there that are offering vaccine. Now, we know it may be limited to 100 or 200 doses at some of these locations initially. It will keep coming every week. And so we'll have to be moving through this methodically, but we are on offense, and we have vaccine that is moving. We wish it could move quicker, but we're very fortunate in this country that we have vaccine that is moving now. So your efforts to help us assure through your media channels that folks are being patient and they understand that it will take time, it would be very much appreciated.
This is Anna with Idea Stream again. Terry, if you could just clarify, just to make sure I'm totally understanding. So the pharmacy, you said 90 providers will be handling the phase 1B, but that's not going to be starting next week. We still need more time for that? Or was that just for the Board of Health? Yeah, so about 90 providers will be getting vaccine next week to start 1B. What we made a decision on is as a health department, given the size of our 1A population, we've heard a lot of our 1A folks, healthcare providers, calling us saying, are you going to move on to 1B? And the answer is right now, we're going to finish the job working through 1A to take care of these frontline folks. And it makes good sense in terms of use of resources right now. And we will transition in a bit to do more, to do 1B and to incorporate 1B. But in this near term, given the number of folks that still need access to 1A, it makes sense for us at the Board of Health to continue that public health responsibility to help to close the gap on 1A interest. But those other 90 providers, which is, way more locations than we ever had for 1A, will be focusing on 1B. So I think given our county and their capacity here, it makes good sense to spread our resources out and divide this big responsibility across a range of agencies. But we made a choice personally to wait a little bit to begin 1B. And we're just one now of many providers that will be offering a vaccine. And so it's just for us, it makes good sense to use our resources in the near term that way. Okay, but those pharmacies are going to be starting next week, or do they get their doses from you guys?
No, they'll be getting their doses direct shipped So they'll be starting next week.
Thank you.
Welcome.
This is Courtney again. I had a jurisdiction question. Everything you guys have been talking to us during the pandemic so far has been, you guys focus on your jurisdiction, the Cleveland Department focuses on their jurisdiction. Now that this is starting to expand to older folks, does anyone have to worry about where they're getting their vaccine and who it's coming from? If older folks in Cuyahoga County see an opportunity to get vaccine in Lorain County, perhaps, because it's easier there, how should that work jurisdictionally with our population?
Well, the first thing I would say, Courtney, is very similar to when the H1N1 vaccination campaign was done, over 10 years ago, is this vaccine is a federal asset. So all of us have paid for the development of this vaccine. Having said that, we think it makes sense that if the vaccine is being distributed proportionally, also looking at a social vulnerability index that the state has created and thinking about overall population, that getting it close to home rather than traveling across the county will help to assure that everyone has access over time equally for the vaccine. And so from our standpoint, we think it makes good sense to try to look closer to home for the vaccine if you're a senior. And you may need to wait a little bit as more vaccine comes because of the demand that we see. But certainly the design of the distribution of the vaccine that the state set up is specifically meant to deal with per capita allocations as well as social vulnerability in the distribution model. So you should look close to home first, and that also allows for providers to think about their populations in each of their counties and how best to position themselves to serve them. Certainly in counties like Cuyahoga and Franklin and Hamilton, there'll be a lot more providers that are offering a vaccine. And so it is really meant to be proportional to the size of the county and the risk. So look close to home first. It would make sense to me. And I think that's the way people should approach it.
Thanks.
Hey, Terry, Brian Duffy, one more time, and I'm sorry. I just want to be doubly sure that I'm clear on what's going on here. 90 providers who have their vaccine shipped directly to them in the county, in Cuyahoga County, will be providing vaccinations for people 80 plus starting next week. But it's just the County Board of Health, you guys, who are not moving forward that process. Is that the right distinction?
Right, and I did say about 90 providers. It may just be under 90 providers, but yes, that's a distinction. We're going to continue to move through 1A, and we will begin 1B in a bit. But right now, we have a lot of responsibility still to the first phase, and can't leave those folks behind.
Thanks, Terry.
You're welcome.
Does anyone else have a question they'd like to ask? All right, hearing none, I'd like to thank all of you for your attendance. As Commissioner Allan said, please look later today on our website for inclusion and posting of that provider list. We are simply waiting for delivery of that from the State Health Department, so as soon as we have it, we will be sure to post it. Thank you all for attending, and we'll remind you that next Friday at 2:30, we will get back to our normal press conference schedule in conjunction with the County Executive's Office. Thank you all very much for coming today.
Thanks.